one more case study. So Mr. Doe was referred for testing to ascertain his level of cognitive impairment resulting from an injury after he fell. He lost consciousness for a few minutes, but he woke up in the ambulance on his way to the hospital. He has a scar over his forehead on the right frontal lobe area, and he was rendered unconscious for a short period of time, but there's no history or information about post-traumatic amnesia. CT scan did show that he was having some difficulty with swelling in his brain, but it subsided fairly quickly because he was released 3 or 4 days later. Relevant history, he's a 38-year-old Chilean man who's bilingual but mostly monolingual Spanish, so all of these tests were actually given in Spanish. He was administered the Spanish version of the Wechsler test, the Neuropsych, which we talked about a little earlier, that looks at different domains, the CTMT, which you have in there, the Trails test, and the Spanish version of the Milan. He's got a 7th grade education. He's been a carpenter and a chef his whole life. He has a really good work history. He denied any history of substance abuse or alcohol abuse. He denied any history of previous head injuries or medical problems. But now, after this head injury, he has reported that his lifestyle has changed dramatically. He is no longer as physically active as he used to be. He reports attention problems. He reports memory problems. He says he's always forgetful. When he showed up to the office, he was malodorous and disheveled. His attention and concentration appeared to be impaired, apparently evidenced by him being easily distracted. He was easily fatigued by the testing and asked to take many breaks. And then he appeared to be even more distracted when he said that he was tired. And he had no delusions, no evidence of thought disorders. Thoughts were linear and goal-directed. He gave good effort. He didn't appear to be internally preoccupied. His mood and affect were euthymic. He showed no mood disturbances. And his thought process was notably concrete. So, let's look at the test results. But the orientation, he was oriented, his immediate memory seemed okay, his visual constructional ability appeared impaired, he had good language skills, and his attention and delayed memory appeared to be average. And of note with his testing were reversals and repetitions on the, not repetitions, reversals and changes on his complex figure drawing of the Neuropsych. He rotated it. So instead of the square going this way, the rectangle going this way, it went this way. But he got all of the details. He just rotated, even though he was told not to. And that was also seen in his block design of the EWIS, which is the Spanish version of the WACE. So his processing speed and then executive functioning with regard to cognitive flexibility. Okay, so yeah, Trails is showing that his speed and cognitive flexibility are profoundly impaired, especially with the 6 impulsive errors made on the 5th trial. Although not listed on here, there were actually all 5 trials of Trails were given, and he scored in the profoundly impaired range on 1 and 2, but on 3 he did a little bit better in the average, low average range, which suggested that he was learning, and he was able to get a little bit faster as he was learning how to do them. But on Trails 4 and 5, which measure cognitive flexibility, he got back in the profoundly impaired range. Vocabulary measuring crystallized intelligence, and if you look at his scores on the WACE, what are we seeing? In general, he is showing that he's got some deficits, so it looks like he might have been a lower functioning individual to begin with. However, the Neuropsych, like the R bands, is looking at semantic fluency, how many things can he name in a minute. So he is able to draw upon that area of the brain to come up with categories. The frontal lobe, but he's old school learning and crystallized intelligence suggests that he was always at a lower level of functioning. Right. The whole test would be vocabulary because that looks at old school learning. Whereas the Neuropsych does not look at old school learning, it looks at current ability to think in categorical ways and generate language. But he didn't give the WAIS, it was the EWIS, the Spanish version of the WAIS.
It's a very old version of the
But it
WAIS.
looks at those different areas. Okay, we have two questions here. One was, what was the nature of his head injury? He fell on his forehead from a 15-foot ladder and broke his elbow and knee and had to have a lot of surgery on his elbow and knee.
And the question of referral was any recommendations for rehabilitation for one of the pain management clinics that's thinking of accepting him?
This actually is very indicative of what might come your way. This is a man who just needed a neuropsych screening to see what sort of things need to be done to help him with his rehabilitation. And this very well might be something that you get. And these are tests that you might administer with the addition of the level of effort. You might want to throw that in there. But he included a cognitive evaluation. He included a test, the CTMT, the trail making test, which is great because it looks at a number of different things. And then the Neuropsych, which is a neuropsych screening test, just like the R-bands. And it looks at the orientation, immediate memory, language, attention, visual, spatial. He's actually showing a lot of different deficits. He's showing us attention deficits and executive functioning deficits on the trails. And he's also showing the visual spatial. And some of the things that we were talking about earlier when we were looking up LASIK is because of the rotations that he's showing with the ray and the block design, we're hypothesizing that it could be an occipital damage from the coup contra coup. You know, he hit here, executive functioning, and his brain bounced back, visual spatial. And so he probably has damage to these two areas of his brain. And I would tease it out. If he had perfect trails, then it would be all back here. If he, was totally fine visual spatial, then it would be all up here. That's how I would tease it out. I couldn't tease it apart with this screener. So in his conclusions, the things that he can mention are the coup contra coup injuries and the fact that he's showing deficits in both executive functioning, frontal lobe area, as well as occipital area and visual spatial.